meetings. Hopefully we can get Connie back on from the League of Women Voters. They are generously hosting this event for us, and Connie was going to serve as our facilitator, and hopefully we can get her audio working a little bit better, but until then I'm going to kind of jump in and run with things until we can get her back up and running. And I know that she was able to briefly introduce, I heard part of the introduction for Dr. Mary Ann Mason from Northwestern University Feinberg School. We'll get us started talking a little bit today about IVDRS and sewers research for us, if you would please, Mary Ann.
Yeah, I'm going to share my screen to start. That will be a good way to begin. You're seeing my calendar. I don't think you want to see that. Stop that there. Try this again. Okay, is everyone looking at my screen? Okay, victory. Welcome everyone. Thank you for quote unquote coming out on this, what is in Chicago a dreary evening. I'm not sure what it is where you are, but thank you for coming out and paying attention to this issue. It's such an important issue for us, for our communities, for people we know and love. So I want to just start off with letting you know that I'll be providing some data and insights from our 2 public health surveillance systems that deal with the kind of deaths we're going to be talking about today, which are suicide, homicide, and opioid overdose. I want us to get all on the same page because when you signed up for this, you maybe weren't aware of what we think of as preventable deaths. But for us in public health, we think of preventable deaths are deaths that could have been avoided, where people die too young and there are too many years of life lost. And these are deaths that could be avoided with some targeted public health interventions around lifestyle and behavioral health factors, you know, things like smoking and substance use, self-harm, social isolation. They also are deaths that are affected by socioeconomic status. So they're disproportionately happening among people who are or underemployed, people who live in poverty, and people who have fewer years of education. They also are deaths that cluster in communities that have some not so great things going on with them, including pollution, abandoned buildings, high rates of vacant lots, things like that. These deaths can also be prevented by, we know we can do some things to prevent these kinds of deaths by using high quality evidence-based physical and mental health services like CBT, which I think Becky talked about being certified in, about proper pain treatment, about medically assisted treatment and those sorts of things. So even though we're going to talk about some things that are not so cheerful, I want people to keep in mind that we can do things to prevent these deaths, and we have some tools. So you know, a lot of people wonder why we focus on this area, and one big reason behind that is the economic costs of this are so high to our country, to our state, to our communities, and their economic costs that are associated with each of these types of deaths. For example, a homicide would cost about $17.25 million, per incident. So that includes the death, the investigation, the possible prosecution, all of those things. It's an enormous toll. And suicide is costly too. there's a study in 2013, I'm sure this has gone up, but that suicides and suicide attempts cost $58 billion in 2013. Fatal opioid overdoses are very costly too. We're in the midst of a crisis in this country that's been going on for several decades, but in just 1 year alone, it's estimated that fatal overdoses cost the US $550 billion. So even if you're not concerned about the human toll of this, the economic costs of this should be driving policy thoughts. But we care too about our community health and the social and emotional costs of these kinds of deaths. And these costs are huge too. In communities that have lots of homicides, home prices drop. And when home prices drop, property tax revenue drops. And when property tax revenue drops, money available for services falls. So it's a kind of a bad cycle there. But also the people left behind from these kind of deaths pay an enormous cost, just in terms of grief and further preventable deaths. People who are friends and family of those who die by suicide experience a high risk of suicide and suicide attempts too. So there's a bit of contagion about this. And homicide survivors, by that we mean people who've witnessed homicides or are in the friend and family network or community network, experience PTSD, substance misuse, and mental health issues as a result of that homicide. So it ripples through our communities like a wave. And then, of course, overdose survivors, and here we include people who have overdosed and their family and friend network, often experience PTSD and other mental health problems as a result of that. So there are many, many reasons why we should care about these deaths. I come at this from a public health perspective, which means we follow the CDC, the Center for Disease Control and Prevention's 4-step process for injury control. And the first step is to understand the problem, define the problem, and we need data for that. We use that data to identify risk and protective factors that can help mitigate the problem. Then we develop appropriate prevention strategies, and then we try to spread adoption of that. So where I land in this 4-part process, or where my projects land, is in helping define the problem and helping define risk and protective factors around these deaths. So that's the role IVDRS and SUDORs can play. Others on the panel tonight will talk about other places in this public health model that they're located in, but I wanted to share with you where we think IVDRS and SUDORs can contribute. So I've used IVDRS and SUDORs several times. Again, they're the Illinois Violent Death Reporting System and the statewide unintentional drug overdose reporting system. Those are public health surveillance systems, which means in the counties that participate in Illinois, we collect data on every homicide, every suicide, and every drug overdose death. And we take the data from multiple sources. So we work with coroners, including the 2 on our panel tonight, to access their reports, the toxicology reports, the autopsy reports. We work with law enforcement. Several of representatives of law enforcement are on our panel tonight. We work with the information in those reports, and then we use vital statistics data, death certificate data from the state. So we put all these things together, and what we have then is the most comprehensive data set on these types of deaths. So instead of just counting numbers, we're able to look more deeply and get to the kind of why is this happening? How is it happening? What can we, and gives us more information for prevention. There are a couple of places where you can get these data. One is online through the CDC's WISCARS online data set, and the other is through requesting directly from our programs, IVDRS and SUDORS, and I put the links up here. The IVDRS website also has a link to a training program to help you access WISCARS if you're interested. Okay. So I wanted to give everyone a contextualizing snapshot of these kind of deaths in Illinois before we got into the more local presentations. So these are looking at data mostly from January to June 2020. So we're looking at right here, the first part of the pandemic taking effect. One of the shocking things about the COVID pandemic is the increase during that time of opioid overdose deaths. This is nationwide, but Illinois has been very hard hit by this. We've experienced a 38% increase in opioid overdose deaths from the prior 6 months. And we see some trends. There's an increase in the proportion of deaths that are in the youth, 15 to 24, adults, 25 to 34, and surprisingly for some older adults, 65 and over. We see an interesting phenomena where overdose among whites is going down, but increasing among Blacks. And we see, and this is a national trend too, an increased presence of fentanyl in these deaths and a decreased presence of heroin in these deaths. I think we're up to something like 80% of these overdose deaths have fentanyl on board at the time of death, and 45-ish percent have heroin on board at the time of death. And that's a real different trend than typical. So now again, these are people who've died of an overdose, but you see 30% of them received naloxone. So there's 70% of these fatalities that perhaps could have been prevented with naloxone. So we're missing something there. People aren't getting naloxone. 3/4 of these deaths happen in a home, a person's own home or a friend or an associate's home, family member's home. And then of the people who died, only 11% had ever gotten treatment for substance misuse. So I think we're missing a population there too. But about 9% of them had gone to an ED or urgent care within 6 months of their death. So we do know they've had some contact with a touch point, as we like to call it. So I wanted to just give you a slide on those deaths. Now I want to do a slide on deaths by suicide. So these data are a little older. Our last year final complete data are 2018. So this is, of course, well before the pandemic. But in Illinois, we had about 1,200 deaths by suicide among the 42 counties that participated in our project. We see a profile here that's much like the national suicide risk, where white men who are 15 older are at the greatest risk. I don't have it on here, but we are seeing some uptick in the younger groups who are dying by suicide. It's not a statistically significant number, but it is a trend in the wrong way. We in Illinois are a little different than the rest of the nation in that the most common method used to die by suicide here is hanging, strangulation, and suffocation. In the United States, about 50% of suicides are firearm. So we have a little different thing going on here in Illinois. And firearms are a very close second in terms of the method used. And then I just wanted to give you a little flavor of the circumstances we collect. About 50% had a mental health problem that was diagnosed, but only 27% were in treatment for mental health problems at the time of their death. So we see perhaps a population that is undertreated here. And then I'll conclude my data on these types of deaths with homicide. Again, the last year we have complete data is 2018. There were 938 homicides in all 42 of Illinois counties. And I'll bet you can guess that was concentrated mostly in Cook County, Illinois. That's where the bulk of those reside. The population at greatest risk here is different than the suicide risk group. It's mostly Black men, and then the mean age is about 33 years old, so younger than the suicide decedents. The most common method used for homicide was firearm. So our firearm problem in Illinois is largely one of homicide. Okay. So I always try to look at where are people coming in contact with others before they die that might be places where we can provide services or think about intervention. So we note that 63% of these decedents made it to an emergency department. So we know that they have exposure there. And about 16% went to a hospital. So, and I know PCAB will talk about this, and Lisa's been very involved in this, but I give you these data to think about not only the people who die by homicide, but this is a place we can reach the friends and family of those who die by homicide, because they often come to an emergency department or to a hospital when these things happen. And then I just wanted to note that about 8% of these homicides are an intimate partner related problem, which I believe is a significant issue. And again, another way to think about where we can reach people and touch people. So I just want you to think about how data like these and the data other people will share tonight can help you identify who's at risk and where are the touch points, where could interventions maybe reach people at risk. And I'll give you some examples from people in this field who do some work. Gun shops, shooting ranges are great places to reach people who own firearms or are buying firearms for suicide prevention. Criminal justice system encounters can be a great place to reach people on prevention and intervention. Schools, especially for the youth, and then healthcare settings. Clearly the emergency department and hospitals would play a role there. And then how can you identify, implement, and utilize evidence-based interventions? And I know there's some great panelists tonight who will be able to talk about what's going on in the Peoria area with this, but here's some evidence-based things that we know work. A zero suicide program that is hospital system based, cognitive behavioral therapy, drug courts, medically assisted treatment, hospital-based crisis intervention, and trauma recovery centers. So I just want people to also think about what are strong intervention-based ways to approach this. So I want to thank you and invite you to stay in touch with me and our team at IVDRS and SUDORS. And I'm going to turn it over to Lisa or Connie, who's ever moderating now, and stop sharing my screen. I assume we'll take questions at the end if there are any.
Yes, we have been getting some great questions that have been emailed into our chat. So we will grab those and try to answer as many of those at the end as we can. Some of them are being answered actually as you were going through the presentation. But we want to see, Connie, do you want to try it one more time?
Let's give it a shot. Am
Okay.
I coming across here? Okay.
Right now, very good. Yeah.
Good. Okay. I think, thank you very much, Dr. Mason, for that just information. I think that you gave a great overview of the issues and some of the statistics from the past year. And bring our panelists in now to give their input on how they're addressing these issues and what they're noticing. So we're going to go, our first question I will present to you in just a moment. You will each have approximately 2 minutes to answer the questions, this question, and we're going to go in this order that I'm going to corner Harwood. We'll go first, then Brian Asbell, Roland Tinley, Sue Tisdale, Becky Rossman, Katie Endres, and Jennifer Bannock. We'll tie things up on her end. The first question is, please briefly explain your role in working with premature death due to violence and/or drug overdose. And Coroner Harwood, if you would address that first, please.
Sure, thank you. And thank you again for having us tonight to discuss these important issues. My involvement with preventable death started when I got elected and I joined the IVDRS and SUDORS group back in 2016 in the midst of data collection. I've been strongly involved in the community with suicide prevention in different avenues with working in the schools with the Holt Health Center and also in preventative strategies in the community with a walk that we have here in Peoria County called Whitney's Walk, which has been pretty fluent here in the county, which is great. I'm all about awareness, and I think letting the public know exactly what's going on in our community regarding the families and the victims of the violent deaths is so important. And so part of our strategy is really to get the data out there to people, because a lot of people, I believe, don't know. They only hear small snippets through the media. So trying to get that information out there as much as we can through social media sites and things like that has been one of our efforts here in the county as well. We follow and monitor all of our drug overdose deaths, working in the community. About in 2016, I was acquainted with Dr. Tamara Olt, whose son died from a drug overdose several years prior to that. And I've worked with her and then even with Sue Tisdale in the midst of trying to get the information out to the public about why are people dying from drug overdoses. And the big part of that in Peoria County, and I think Sue can attest to this, is trying to get rid of the stigma. And that's been a battle from day one, is the stigma. And so continuing those efforts to put a name with the faces of people who die from a substance use and things like that. So I could go on and on and on about different things, but I'll let the other panelists go. But the efforts really for substance use is the stigma removing and things like that. And the same thing with suicides as well.
Thank you. And Sheriff Asbell.
Thanks, Connie. Thanks everyone for tuning in tonight for this much needed talked about subject. Obviously, law enforcement, with my role as sheriff, dealing with everything that we're talking about with this subject matter tonight, we're typically the first responders, along with Peoria Fire. Interesting though, at the sheriff's office, that we primarily police the rural unincorporated parts of Peoria County that often depend on volunteer services versus your municipalities that have full-time fire and emergency services 24 hours a day. So that puts a different role for the deputy sheriffs that work on the street, that they have to wear a lot of different hats. The other thing I'd like to address is obviously the jail falls under the sheriff's office, and this is something that we deal with this on the back end too, even discussing those that have been accused of some of these violent crimes or have these crises in their lives. And we spent a lot of time here in the last 4 or 5 years building programs just to address that. I work a lot with Jamie and other people on this panel. We have a wonderful relationship. We have a wonderful team here in this area, and we're very fortunate for that. But like Jamie too, the suicide prevention is something very personal to me. My second day as sheriff, after I was appointed, my wife's brother committed suicide. And this was a police service call that we had to deal with. So I see it from the professional vantage point, but as well from the personal vantage point to see what this does to a family. So look forward to more discussion tonight.
Thank you. And next, if we could hear from Chief Battalion Tinley.
Good evening, everyone. As a battalion chief of emergency medical services, my role is to oversee the medical operations of the EMTs and paramedics of the Peoria Fire Department. We have 164 providers, and we cared for 16,411 patients in 2020. Within my role, I've become a self-proclaimed data geek that utilizes Python data analysis to answer many questions daily, from our training information with staff to our response analysis. We're here because Peoria sees its share of violence. The fire department responded to 1,560 patients with assault, knife, firearm, and abuse documented within their patient care reports from 2018 through March 31st of 2021. At this time, we really don't have a program to prevent violence, but in researching for this presentation, we do have a lot of information related to age, time of year, time of day, and location that we can utilize to assist our community with prevention efforts. We noticed a large increase in naloxone administrations during the 2015 to 2017 timeframe. We asked some of our public and private stakeholders to meet to discuss the increase and begin putting some steps in place to help decrease substance use disorder related deaths. We've recognized those high volume areas, partnered with the Human Service Center, now Unity Place, to provide naloxone kits to the citizens at the neighborhood fire stations. We also have a naloxone leave behind program that allows a crew that has provided or responded to a situation where naloxone was utilized to leave a kit with 2 doses of intranasal Narcan. And we leave that with family, friends, or the patient themselves, along with a list of resources for help to assist with substance use disorder. In 2020, we provided 278 doses of naloxone. In 2020, early in the COVID-19 pandemic, we noticed a lot of infant deaths due to co-sleeping situations. And similarly to the substance use disorder issue, we started the conversation with many community partners. With COVID, we're just kind of getting off the ground with this, and we're looking at education, healthcare influence, and mobile integrated healthcare with our transporting ambulance service to help provide these youngest patients with a good chance at life also.
Thank you. Next, we'll go to Sue Tisdale. Again, if you would briefly explain your role in working with premature death due to violence and/or drug overdose.
Hi, good evening, and thank you for having me here this evening. This is a topic that hits home for me when we talk about overdose deaths and prevention, of course. So I have a non-for-profit, Dooney's Defense in Fulton County, established in memory of my son that died from an opioid overdose in 2015. Prior to my son's death, I had never heard of naloxone or Narcan. And the very year that my son died, I connected with Jolt Harm Reduction, Dr. Tammy Old, and was trained on how to distribute and train others in administering naloxone. We still have a lot of work to do in that area, that we still have a lot of people that don't know how to prevent overdose deaths or what causes an overdose. And my role with Unity Place as a community educator is to provide that education and the prevention part of it, of course. April 2020 to the end of March of this year, even with COVID isolation and restrictions in place, still managed to get in front of over 500 individuals and distribute over 6,000 overdose rescue kits. It's still, like Jamie had mentioned, a lot of stigma and shame associated with substance use disorder, opioid use disorder. And that plays a big part in my life to try to reduce the stigma and shame. I feel by sharing my story, maybe others will feel better about opening up, coming forward, reaching out and asking for help, and putting in place resources and support in areas, just as was mentioned previously, in hospital EDs and in various locations to make this readily available, accessible, I think plays a really important role.
Thank you. And next we go to Becky Rossman.
So as the CEO of PCAB, we're really going to focus on decreasing violence through a multitude of avenues. We're really looking at a lot of education for some of the younger members in the community, focusing on everything from coping skills to really educating the parents. I'll tell you, the first homicide I was called out on, I was surprised to see there were 3 children under the age of 8 watching a body being carried out. And to me, that's just normalizing that the African-American males in our community, you know, that this, obviously it is a reality. Part of the reason I took this position is many of the young men I worked with at Neighborhood House would tell me they didn't expect to live past 20 or 25. So that's why they dropped out of school and they really didn't have a whole lot of ambitions. And we also had a childcare on site at Neighborhood House. And we had a 3-year-old with a gunshot wound, and over 50% of our kids, they had a lot of trauma because of losing a parent or a sibling to gun violence, sometimes both. They had parents who had overdosed. In fact, all my staff were trained on Narcan, and we've had to use it a few times on the South Side. And a lot of their parents are in prison due to gang-related violence. So we're going to have to go at this a lot of different ways, but really kind of as Sheriff Aswell talked about, you know, really a lot of organizations working together. So we're looking at partnering with a lot of different community organizations, because we're not going to be able to do this alone.
Thank you. And next, if we could hear from Catherine Endres.
Yeah, thanks, Connie, and thanks for having me this evening. So for the past 3 years, I've produced the annual Peoria County Mortality Report, which provides an overview of the leading causes of death in the county and their contributing factors. Throughout the report, I highlight where disparities exist and provide more in-depth analysis of areas of concern. I also lead the Narcan advisory group in collecting data on Narcan administrations throughout the Tri-County area of Peoria, Woodford, and Tazewell counties. And I collaborate with our GIS team to maintain our online opioid awareness hub. And as the nurse practitioner in the federally qualified health clinic within our health department, I prescribe medication-assisted treatment for individuals with opioid disorder.
Thank you. And next, we'll go to Jennifer Bannock.
Yes, thank you so much. So I would echo a lot of the sentiments mentioned by Coroner Harwood. I am, as I mentioned, up in Lake County, and I'm really here just to kind of give a perspective from a different county, different demographics. I see myself as a person that facilitates the narrative between the families of our decedents, and also builds a bridge with stakeholders who are interested in supporting mental health measures. I recently testified on behalf of some legislation that's been put forth by Senator Melinda Bush, which would mandate that Narcan is given whenever an opioid is prescribed. Interestingly, the Illinois Med Society actually opposes this legislation. So as a certified registered nurse anesthetist and a healthcare provider, and now the coroner, this is definitely in my wheelhouse. And so I had an opportunity to testify before the Senate committee advocating that, this is a measure that I would definitely support. So that's how I see my role.
Thank you. Our next question, you will have 5 minutes to respond, and we will start with Coroner Harwood again. And the question is, what are the trends in violence and or overdose death that you're seeing in your area of expertise, especially related to the pandemic? And
yeah, I had to have 10 seconds to find my mute button. I really have a disadvantage right now because my epidemiologist in the county is going to follow my data and tell you whether I'm lying or not with what we're talking about. So I think I have the unfair advantage, of course, but a lot of people know who's on the panel right now that 2 years ago, the infant that I had adopted, his father was actually one of the homicides in Peoria County. And the year before that, his mother died of a drug overdose. So all this is very personal to me when I look at the data and I look at the trends of what's going on in Peoria County. Specifically related to the pandemic, when I'm looking at my numbers, which is what I'm looking at right now, we really did not have in 2020 an increase of our overdoses, or I'm sorry, of our suicides, as I'm looking across our plot. And I'm looking at starting in March, moving through 2018, 19, and 20. March is our highest month for suicide in our data set. But in March of 2020, we only had 3 reported deaths in Peoria County of residents that actually originated in Peoria County. And the trend kind of stayed low throughout the year. The total number of suicides for 2020 were 20, and that was down 1 death from 2019 and down 2 deaths from 2018. One of the things that's of particular interest to me, and Katie can collaborate this or she can disprove it, but our suicides that we had in 2020 really collected out of a demographic of a lower social economic. And when we talk about that, we're looking at educational disparities, healthcare disparities, racial disparity, income, housing, all those things related into these particular places as far as incidence is concerned. The average income of those zip codes is under $50,000, and from all of those zip codes combined. So, and that's combined household income. So we have to include, and we can't negate the fact that these disparities of suicide, and I can also include our overdose deaths into that same demographic, is a strong comparatively to the other zip codes that we service in the county. The housing, the education, the health, all of those things are playing a role in why people are dying by overdose and or by suicide. And then we can look at the homicide data as well, and it's concurrent, it's the same. Now, in 2018, we had 29 homicides. In 2019, we had 24. And 2020 was a significantly low year for us, and we only had 15. Currently in 2021, we're sitting at 7. So 2020 was a low year for us. I think the isolation and staying indoors played a huge role in that. I really don't have a rhyme or reason why our suicides decreased during that time period of the pandemic either, other than the fact that they did. Our overdose deaths were up in 2020. However, not significantly. They went up by 6 deaths. And social isolation, the distribution of Narcan, not being able to go to meetings, all those things I'm sure played a role in it. And I'm so happy that Sue mentioned that she got in front of so many people, because had she not done that and had that passion for that, our numbers would be so much higher. I think that's all, unless anybody has any questions about that.
I think I'm next after Jamie, and this is where I might upset some of the academics on the call, and I'm sorry, doctors, with the data. I know what Jamie just said, where the suicide deaths were down, but I can tell you from the practical application side, it sure seemed like it was up. At least the crisis calls that we were sent to here in this past year. It seems like so many calls for service that were more violent in nature. I know Dr. Mason said something earlier about the significance of domestic related violence. It was, I think, 8% she said, and I'll agree with that wholeheartedly, because it seems like a lot of the violent calls that we did respond to in this last year were domestic related. And I think it's just something like Jamie just said. It was this, everyone's in their households together, and there were so many other collateral issues that came with this, relative also to addictions and overdoses. Trends are definitely up, and there's so many outliers here with this past year, even with reporting. because a lot of the data we often pull is from the jail. And we put a lot of different rules and regulations on this facility due to COVID. I do not like the trends we're seeing. Unfortunately, I think with the economic struggles that we're going to see more of in the next coming years, I think all of our economists are saying we're in this K-shaped economy right now, which basically says the rich are getting richer and the poor are getting poorer. There's going to be more incidents of self-harm. So we really have to, have this kind of collaboration from all fronts, working together on all these different issues, whether it be awareness, it's just advocating for a safe community. But collectively, we have to do this together to try to stop some of these unfortunate events. And I'll pass the torch with that.
And Chief, time.
So trends that we're seeing for violence, and I looked at violence in general because the number of homicides, suicides that the fire department responds to really doesn't do it justice for our area. Like Sheriff Asbell said, we've seen it. We feel like we've seen an increase, and I'm gonna be completely honest with you. In 2020, I was surprised. We did actually see a decrease. So we've seen a decline in documented calls for assault, knife, and gun violence. We do not respond to all these instances, as sometimes these patients are thrown in the car and driven to the hospital. But in 2018, we had 516 instances of violence. In 2019, we had 497, and in 2020, we had 455. Our assault calls peaked in August of 2020 at 41 for the month. Our stabbings peaked in June of 2020 with 19 in 1 month. And our firearm assaults also peaked in June 2020 with 16 in 1 month. While researching for this presentation to reinforce the questions that we were anticipating that we were going to be asked, I heard about violence a lot more in 2020. So I dug real deep into this data to try and see if I can find some trends or some specific areas and locations to see, is there an area that we could focus on as opposed to writing the whole city is violent. So when viewing the city of around 109,000 people, it gets easy to get lost and frustrated in the data as we're viewing it. We are blessed as a fire department to have the ability to break the city up into slices that are more manageable. First viewing it as a whole, then we sliced it down by station, and then we actually have zones. And zones are roughly 6 block by 6 block areas that we use to determine our station and apparatus responses. And our report management systems capture all of this data directly from the CAD system, which gives us a very small view into specific areas. So we looked at the entire city from 2018 through March 31st of 2021, and then we looked at that as a whole, then we looked at the station data. And over that time period, Stations 4's area, which is in the south end of Peoria, was the most violent over that 4-year period. And then we dove into it a little bit more, and I found 3 zones in Station 4's area, which accounted for 48% of the violent calls in that area. Citywide, the age group of 21 to 30 accounted for the most patients suffering from acts of violence. This was consistent in 2 of the 3 focused zones in Station 4's area. Of interest in viewing those age groups, 6 or 11% of the 53 11 to 20-year-olds that were victims of gun violence were within 1 single zone. So when we're looking at these zones and looking at the very specifics, we can see increases over the years. In 2018, we had 3 patients in the 3 zones. In 2019, those 3 zones accounted for 16 patients, and in 2020, they accounted for 12. This analysis highlights a specific problem in a specific geographical area. We're beginning the process to view the economic and social aspects in those areas. What I can tell you is the highest median income for the 3 zones that I looked at is $33,000 a year. So we may be able to get a little bit more information, and then can we create some focus in those areas. Naloxone doses increased substantially in 2020 as the pandemic took hold, with lockdowns making the community access more difficult, isolation influencing the mental health of our community. In May of 2020, we documented 33 doses of naloxone. In July, we documented 34 doses of naloxone, and that's our our busiest month prior to 2018 was, or prior to 2020 was November of 2019 with 25 doses. When we're talking about documented, we're talking about our crews documented. So we got to understand that Advanced Medical Transport, the Peoria Police Department, and bystanders also provide Narcan. So when we're discussing these numbers, those are specific to we documented, but one of those other agencies may have also provided it. In 2020, we had 39 cardiac arrests related to opioid overdose. Through the efforts of our personnel and the AMT personnel, 20 of those individuals were revived and several survived to be discharged from the hospital. So we had a lot of success with our cardiac arrests, which can also attribute to the not having a huge increase in deaths related to opioid overdose. Thank you.
Thank you. Sue Tisdale.
Yeah, so I just kind of wanted to also reinforce of Roland's data about all of that too. And we all talk about data. Data is so important, but we have so much that is underreported when we talk about overdose. Simply because we know and we have documents of overdose deaths. What we don't really have information about is overdose that occurred, but it was successfully reversed with Narcan and the person survived. So we get that information from first responders. That's not the problem. It's from bystander administrations and so on, people that don't go maybe that call 911. They don't go to the ED. They don't call 911. So there's a lot of underreporting when we talk about overdose and overdose death. The CDC is reporting, and it's also underreported at this point in time because we have such delayed data reporting when we talk about overdoses and overdose deaths. Over 81,000 overdose deaths that have occurred from May 20th to the previous 12 months of that. That's we've had a huge increase. And I think somebody touched on that earlier, a nearly 40% increase in overdose deaths associated with synthetic opioids such as fentanyl. We're also seeing an increase in overdose deaths and overdoses with contributors from cocaine and psychostimulants such as methamphetamines. So harm reduction, which includes Narcan training and distribution, syringe exchanges, any methods that we can meet people where they are currently at. And I explain and go into details about this when I do my educational portion of my position. Everybody sees what a form of recovery or treatment may be. Everybody's different with that. So 90 days in rehab may not be okay for the next person. So generalizing what treatment may be and zeroing in on that and not having a variety of resources, I think, is something that we in our communities we really need to work on. I know with COVID from March through late last year, we've seen an increase in overdoses and an increase in substance use, period. The isolation restrictions that were in place that affected all of us really affected those that may have been in recovery, that were dependent upon seeing a person face to face for counseling services or whatever that may look like for mental health and substance use treatment. So lack of that human connection was a huge contributor, I feel. We've seen an increase in a lot of mental health issues and coping and dealing with those and having readily available resources for individuals that are willing and ready to get help has been quite an obstacle at this point as well, and even with COVID in place. I mentioned relapse because we have a lot of people that have been in recovery, no matter what period of time it may have been, that experienced big stressors due to COVID, whether they lost a job, financial stressors, changing in the environment that everyone has obtained as a normality, changing that and rearranging that has really affected everyone. Our rural areas, I serve 14 counties, and even outside of Peoria County, all the bordering counties, you know, we see poverty, unemployment, lack of resources and support in these areas. And I think we're learning from COVID, which is a positive, where we really need to increase those services and what the demand really is now. And with that, you know, continuing to make Narcan and the training accessible and available to anyone, and in, you know, really critical areas. And a lot of the individuals on this panel and the Peoria metro area have assisted in making that happen.
Thank you, Sue. And next we'll go to Becky Rossman.
So some of the trends I saw during the pandemic, even at Neighborhood House, I worked very closely with Prairie State Legal and Heart of Illinois United Way. And we talked multiple times in different panels that they had a 50% increase in domestic violence calls. And that was second only to food insecurity. So kind of to support what Sue pointed out, when you have those lack of resources, it does lead to suicide as well as violence. Now, since I'm new to this role, I want to thank Marianne and Lisa for sharing some data with me from Northwestern University. So between 2014 and 2018, there were 79 homicides in Peoria County, and 65% of those were due to firearms. And as everyone's talked about on this panel, it's very disproportionate, as 76% were in African-American community with only 15% in the Caucasian community. Now, I did reach out to someone in the target offender unit at Peoria Police Department, and he shared that there were 18 fatal shootings in 2019, and it went down to 14 in 2020. And obviously this isn't all the homicides. We were just looking at those attributed to firearms because that's PCAB's main focus. But he felt that while the pandemic could be a variable, really they saw an increase in violence as well, but they also attributed it to the largest group associated with violence. The largest group associated with violence were all sentenced to federal incarceration and got them off of the streets. So I'm a big supporter of data, but I'm kind of seeing anecdotally as well that, you know, violence has gone up in a lot of different areas.
Thank you. And Catherine Andrew.
Yeah, so we've seen a consistent increase in Narcan administration since we began collecting data through the Narcan Advisory Group in 2018. And from 2017 through 2019, we saw a corresponding decrease in overdose mortality. So from 59 deaths in 2017 to 46 then in 2018 and 37 in 2019. However, in 2020, we then saw a slight increase in overdose mortality to 43, despite a continued increase in Narcan administrations throughout the community. The month of March had the highest number of overdose fatalities for 2020 at 7. And now our coroner can correct me if I'm wrong, but I believe he attributed this to increases, reduced access to treatment and harm reduction services during shutdowns, as well as a contaminant known as brorphine, which is more potent than fentanyl and contributed to 3 of our overdose deaths. Another observation based on both our Narcan and mortality data is that those using opioids seem to be an aging population. Review of our Narcan data from the past 3 years shows decreasing administrations among those between the ages of 29 and 39, while administrations to those between the age of 40 and 49 has been increasing. Our mortality data showed a similar trend in overdose deaths. Overdoses were the second leading cause of death among those between the ages of 15 and 24, and the leading cause of death for those between the ages of 25 and 44 in both 2017 and 2018. Then in 2019, overdoses remained the leading cause of death for that highest age group from 35 to 44, but then that mid-age group from 25 to 34 tied with homicide as the leading cause of death. And then there were no overdose deaths among that youngest age group in 15 to 24-year-olds. The leading cause of death, however, in that age group for the last 3 years has been homicide. And in 2018, I have that there were a total of 24 deaths due to homicide among Peoria County residents. And you may hear differing numbers because my data is specific to people that reside in Peoria County, whereas our coroner may include deaths that occurred in Peoria County, but the people were not residents of our county. So if you hear a slight difference in numbers, that's probably the reason. So this was a 62.5% increase compared to the previous year, in which there were 15 homicide deaths. The following year in 2019, there were 30 homicides, which is twice the number from just 2 years prior. So as with many health outcomes in Peoria County, we see that certain populations are disproportionately impacted by violence and overdoses, as others have mentioned tonight. So people that identify as Black or African American, as well as those from our 61603, which is our East Bluff and North End neighborhoods, and then our 61605 zip code, which is also referred to as the South Side, these communities are disproportionately impacted by both violence and overdoses. In the 61605 zip code, overdoses were the 4th leading cause of death in 2017 and the 3rd leading cause of death in 2018, while being the 8th leading cause of death overall for Peoria County. And deaths due to overdose are more prevalent than those due to respiratory disease and dementia in this specific geographic area. This area, as well as that of the 03 zip code, is also disproportionately impacted by deaths due to homicide. Homicide was the 3rd leading cause of death in the 61603 zip code in 2018. So in addition to disparities with regard to that geographic location, that zip code, racial disparities also exist when it comes to deaths due to overdose and violence. I previously mentioned that homicide was the leading cause of death for individuals between the ages of 15 and 24, but what I didn't mention was the racial disparity within this age group. The crude death rate due to homicide for Blacks or African Americans between the ages of 15 and 24 in 2018 was 134.2 per 100,000 population. The rate for that of their white counterparts in the same age group was 0.
Thank you. Next, we'll go to Jennifer.
Yes, thank you. I will just offer a little basis of comparison. It's easy to get lost in some of these numbers. Up in Lake County, just looking at our statistics for the calendar years 2018, 2019, and 2020, for homicide and suicide, for all of those categories, we saw slight increase, especially in homicide. There were 33 in 2018, homicide in 2019, 33. In 2020, that bumped a little bit up to 38 deaths. In 2018, for suicides, we saw 68, a slight decline in 2019 at 65, and then an incline in suicide deaths in Lake County at 72. The most significant increase we definitely saw was in overdoses or poisoning. In 2018, 98 deaths attributed to overdoses and or poisoning. In 2019, 94. And in 2020, we saw a 34% increase at 126 deaths in Lake County due to overdose and poisoning.
There, thank you. Thank all of you for your answers. They're very thorough and thoughtful and really give a focus to the issue that our community is dealing with. Our next question is, what is the importance of public awareness in combating violence and overdose death? Explain some of your efforts to combat premature death. And 2 minutes of time, if you can do that. And we'll start first with Coroner Harwood.
Sure, thank you. One of the things the CEO of PCAB, I can't remember your name, I'm really sorry, I've only met you one time, but I met her on scene that day where we had a victim of a homicide and another one who was critically injured who ended up passing away. And she mentioned the normalization of having a body hauled out of a house with a crowd of 200 people and most of them, you know, children in it. And I think I think that's significantly important when we talk about prevention, that we don't normalize the violence, because it's not normal to see that as a 7-year-old kid, or even as an adult, that happens. We have to get to the parent first, and we have to support the parent. In church right now, we're talking about it takes a village to raise children, and that's so incredibly true. We can't expect a single mom with an income of $20,000 a year to be there for her children, help with homework, provide meals, transportation to school, and things like that. So it starts in the heart of a child, and we have to be able to support children in that instance. And then that takes the public. That takes the public to know what's going on in their neighborhoods, what's going around their neighborhoods. I live in a neighborhood where there's never been a homicide, but I support communities where they're happening all the time. But I don't think people understand the gravity of that, and how it affects the child to go through that type of trauma, and then to think they're going to go to school and learn how to read and get a decent meal. It's just not going to happen. It takes an entire community. And I think having that awareness in the community is really what it's going to take, specifically related to homicides. And regarding overdose deaths and suicide deaths, I really have to strongly focus on stigma, and stigma in two ways. One, that people who are struggling with a mental problem, anxiety, depression, bipolar, and things like that, they don't feel embarrassed to seek out help from a doctor or a family or a friend or something like that. And the same thing with suicide, when they're going through the struggles of depression, to reach out for people. They're embarrassed because we've put a stigma on mental health. Historically, since I became a nurse, it's always been a stigma historically. So and the second part of that is people in the community marginalize people who have a substance use problem, or they marginalize people who have anxiety or depression, and in which case they feel like they can't seek help or they can't ask for help. And I think it takes a village of people to remove those stigmas, and that's really what it's going to take, in my opinion.
Thank you. And we'll go next to Sheriff Asbell.
Thanks, Connie. Yeah, public awareness is critical. It has been critical. It will continue to be critical to combat all these instances of violence and overdose and suicide, incidents of self-harm. I've personally been very outspoken on so many different levels relative to reform on so many different things that we do. And it's come at a cost. I'm not the most popular person at the sheriff's convention. I often have to sit alone at the lunch table because they don't agree with a lot of the things that I advocate for. However, in acknowledging that, so much of what we do is the awareness, but it's also building the relationship with those involved in the system, whether it's they are suffering from an addiction, whether they are part of the violent culture, whether they're part of the gang. That is something that I've really tried to concentrate on since I've been sheriff, is building these relationships. I will say, until I'm no longer in this position, that the number one influencer of public safety will always be employment, gainful employment. And it's something about having a sense of self-worth that will fix that household, and that will help the next generation. Their children will have a more stable, home, and they'll be our next doctors and lawyers and people on these panels. And that's where I'm kind of in this in-between space right now, because of what we're trying to balance this new reform legislation, because I don't see I do see where we're going to lose these opportunities, especially at the jail, with a lot of the efforts that we put forth in the programs and services, whether it be cognitive behavioral therapy, whether it be drug and alcohol counseling, or jobs partnership program. I think there's going to be less opportunities for these moving forward. And without that accountability piece, I'm not sure how many people will be involved in these programs. If they're off in pretrial release, everyone goes to church when they're in jail. And if you don't have that piece in the community, I'm fearful that you're not going to have success on that level. But we'll continue the fight.
Thank you, Sheriff Asbell. Chief Tenley.
Yeah, from the fire department's perspective, public awareness is very important in combating both violence and overdose. Both of these occurrences carry with them a large stigma that prevents people that need assistance from seeking it, as well as leaving a trail of trauma throughout the neighborhood affected that extends out into the entire community. The trauma of seeing or hearing about violent acts in the neighborhood, along with what is seen on the news and the social media daily, is normalizing it to our young and most influenced civilians so that they're more apt to utilize violence to settle disagreements. Some of our efforts for violence as a fire department, we've implemented tourniquets as a treatment option for trauma patients. All of our paramedics are trained in the pre-hospital trauma life support course, and all personnel are proficient in bleeding control techniques and rapid treatment of those critically injured by trauma. We're very blessed to have a level 1 trauma center right in our city that definitely helps decrease some of the mortality. We're only beginning, primarily due to the research for this forum, to see if we can gain some community engagement to discussing the alternatives to violence, to settle disputes, as well as work with some of our partners that are on this panel to get into some areas where we could possibly put some resources and have some conversations. For the opioid epidemic, we've been providing naloxone training to the police department, as well as any community members that attend any of our CPR trainings out in the community. We continue to treat our overdoses. We respond to and promote the Leave Behind program and other agencies that are providing this important outreach. We try to utilize data to determine locations that are higher risk and either provide naloxone and education to those areas or share the data with Jolt and Unity Place so that they're able to fill in those gaps as they become apparent in our city.
Thank you. Sue?
Yeah, I'm going back to awareness and bringing out awareness when it comes to opioid use disorder and even overdose. Every year, my non-for-profit organization, Duty's Defense, has held an addiction and overdose awareness walk. And we try to do that near or around International Overdose Awareness Day, which is August 31st. And it amazes me each event that we've had of how many people that are affected by either substance use and or overdose come out for this type of an event and want to talk and share their stories at that point in time because they trust in the group that they're with at that time. COVID has pushed a lot of other health issues to the back burner, specifically substance use, opioid use disorder. I feel like with COVID and you know, opioid use disorder, substance use disorder is a health issue. This is a huge health issue. And I feel like it's been stuck to the back burner. I'm hopeful though, we're going to find a balance in all of this and be able to start implementing more conversations and get out into the communities more so than what we've been able to do over the past year. Of course, we know data is critical in narrowing in our communities on what and where we need services and what those services may be, and funding for these services. You know, this is what I hear more than anything with a lot of different organizations that I come in contact with is how do we fund, you know, helping people with opioid use disorder, treatment, and so on and so forth. Harm reduction. We need harm reduction clinics in every community. To me, that's like going to a local health clinic for other health related issues. Having a harm reduction clinic is giving care, compassion, and services to people that are struggling with substance use disorder or opioid use disorder. Being able to prescribe other medications to manage opioid use disorder is very important as well. And our governmental leaders are now seeing that, and hopefully that transition is beginning. You know, we still, with financial burdens, housing burdens, you know, all of this, it was hit on about, you know, decent paying jobs, making people feel worthy. That provides better health overall, whether it's mental health, substance use, getting people engaged in getting their lives and their health back in order. And sometimes that takes a lot of doing. But we have good organizations in place and groups that are trying to address all of this. And I'm just thankful to be a part of that.
Thank you, Sue. And next we'll go to Becky Rossman.
Well, some of the efforts at PCAB will be doing, it looks a little bit different than what they've done historically, but really expanding and doing intensive training for our crisis response team. We know it's really important to do wraparound services for those hidden victims, you know, the families of the homicide victims, because they're very vulnerable to re-victimization. Now, what I'm surprised to find is Peoria is a very resource-rich community. And I'm pretty familiar with all the resources, but I'm seeing gaps in a lot of areas. So when we're trying to wrap around these services, if anyone knows about anything like this going on, but, you know, a parenting class for teens. I was just on a panel with the kids who got in a fight at Elevate, you know, trying to be proactive and reach people before it becomes homicides. And I was talking to a lot of the single moms, and I'm a single mom of teenagers, and I know how hard it is. And as Jamie said, you know, if you don't have a support network, so I'm having a hard time finding anything for parents of teens. So if you guys can join us, we're gonna start meeting at the bullpen once a month and just talk about, brainstorm how to get through some things. Other things I can't find, trauma therapy for children under the age of 10 who are on Medicaid. So just one family, I worked with several families now, but one of the families I am working with, she's 67 years old. Her son was killed by gun violence last year, and now she has 4 kids under the age of 10 because the mom's in and out of the system with DCFS. She has 2 older granddaughters, one's in prison in June, and I agree with Brian, you know, employment and stable housing are really important. So we are hopeful to set up services that the day she walks out of prison in Lincoln in June, we will have those things set up for her. And then we need more services for grandparents raising grandchildren. So all of the families I'm working with are dealing with this because their kids were, you know, unfortunately they were killed. So now they're taking up the reins of their grandchildren. But I have seen this for a long time in the community, even at Neighborhood House, not involving violence. And the other thing we're really looking at is everything's going to be research-based. So when I said we're going to change how we're doing things, I am recruiting for street intervention teams. So in Boston, they had a 79% reduction in gun violence, and that was just by pastors going out and consistently meeting and building relationships. It was replicated in Southern Illinois with a sorority and in Chicago by moms. And this is one thing that is really deterring crime. So that is something that we are really going to focus on with PCAP is things need to be based on data and not just some of the things done in the past. I mean, they were nice, but it was like preaching to the choir. We need to go straight to where this violence is happening and work with the individuals that it's affecting.
Thank you, Becky. And Catherine?
Yeah, so as the opioid epidemic continues and violence increases throughout the United States, more and more people are losing loved ones to these tragedies. You've heard tonight about three of the panelists that have been personally impacted by overdoses and violence, and I too have lost someone to gun violence. So understanding the scope of the problem will hopefully increase community support for implementation of evidence-based prevention strategies, such as medication-assisted treatment, syringe service programs, and street outreach programs. Medication-assisted treatment is the use of medications in combination with counseling and recovery support services to help patients achieve and maintain recovery. It is an effective method to reduce illicit opioid use and has also been associated with reduced risk of overdose death. I prescribe buprenorphine, which is a partial opioid agonist, meaning it binds to the opioid receptors, blocking the effects of other opioids and only partially activating the receptor. What this looks like for the patient is that their symptoms of withdrawal and cravings are eliminated without producing euphoria or respiratory suppression. We primarily receive our referrals for our MAP program from our local syringe service program or harm reduction center that Sue mentioned called JOLT. New users of syringe service programs are 5 times more likely to enter drug treatment and 3 times more likely to stop using drugs than those who don't use these programs. JOLT opened here in Peoria in March of 2018 and has been instrumental in teaching people who inject drugs how to prevent overdoses and how to recognize, respond to, and reverse a drug overdose by providing training on how to use naloxone or Narcan, a medication used to reverse overdose. Also in 2018, the health department convened the Narcan advisory group that I mentioned, and we have since been collecting data on Narcan administrations throughout the Tri-County area. Analysis of this data has shown that the relationship between decreasing overdose mortality and increasing Narcan administration in our community to be statistically significant. This means that this correlation isn't just a coincidence. We were able to calculate that without Narcan in our community in 2018, we would have seen an increase in overdose mortality of at least 8 additional deaths per month. And lastly, at the health department, we are working to implement an evidence-based street outreach program. So Becky and I need to have a meeting so we can talk more about her plans as well as ours, such as Cure Violence, which is similar to the program she mentioned, which treats gun violence as a communicable disease and works to interrupt its transmission among community members. These public health centered initiatives use street outreach workers to connect with individuals at highest risk of committing or becoming victims of gun violence. Evaluations have found that these programs are associated with significant reductions in gun homicides, with some sites reporting up to 70% reductions in homicides and assaults.
Thank you. Coroner Bannock.
Yes, thank you. So one of the ways, we've been working in our community in terms of reducing the amount of opioid overdoses is we have a local organization called Live for Lolly, which sounds like a similar organization to the one that Ms. Tisdale runs, but they are heavily involved in harm reduction. And I think it's really important that we as community leaders do some real talk about what harm reduction means in terms of clean needles, the use of Narcan. When I testified before the Senate committee, a legislator who has a history of being a paramedic mentioned that the use of Narcan is enabling substance use disorder. This is a completely incorrect narrative. And I think that it's important that us as community leaders correct that, that discourse and that those thoughts and those ideas. Live for Lolly, as I mentioned, promotes harm reduction. They have a mobile unit that goes out into the community to deliver fentanyl testing strips and clean needles to give community members with substance use disorder resources. They actually received pushback from the community and stopped running their mobile unit. So, I work very hard to talk to county board members about the importance of these resources, that there is, this is evidence-based research, and, these are interventions that we need to support.
Thank you. And we will now go to our the fourth question. And it's, what can members of the general population do to assist in reducing deaths due to violence and overdose? Coroner Harwood, we'll have 2 minutes for this one.
Thank you. As you've heard from the panelists, a lot of us have been affected by violence, suicide, drug overdoses, and I would find it very difficult to believe that members of our community, exactly where we live, have not also been affected in some direct or indirect manner of the same things. Specifically, what they can do is they know somebody who has a family member who's been lost through violence, who has been lost through a drug overdose or lost through suicide. They need to get involved. In our community, in the Peoria community area, when we're talking about suicide prevention, there's programs at the Holt Health Center they can volunteer with. They can get involved with Whitney's Walk for prevention strategies and awareness, walk with a family who's suffered through a family member who's been lost through suicide, and provide support. And as far as violence is concerned, like I said before, we have to support the parents and the aunts and the uncles and the grandparents who are now raising children in this mechanism of a loss through a homicide. We have to support the communities who can't support themselves. And I think that's what it's going to take, is for us to jump in with the Peoria Community Against Violence, become a member of PCAV in that street initiative, and become involved in the life of a child. I'm a member of our Rotary here in Peoria, And one of our initiatives in Rotary is Rotary Readers. And we go to a school and we help children with reading, because there's a direct effect of illiteracy and violence later in life, because of course there's job disparity in that. So little things like that, helping a child read, supporting grandparents, et cetera, is going to help. And certainly joining PCAP will certainly help change that as well. So it's going to take everybody in the community. They need to wipe away their stigma for what they feel about medically assisted treatments, because it's proven statistically that medically assisted treatments work. Clean needle exchanges. If anyone has any desire to get a Narcan kit, carry it with them in their purse. People will overdose at the grocery store, at the library, at church. So if you have a Narcan kit, you can help save a life, and it's going to prevent a death, because once someone has died from an overdose, they can't get into treatment. And I think that's so important, that we take that stigma away and we get involved. Everyone should have a Narcan kit. And that's just paramount. So I appreciate it. I appreciate everybody's time tonight too. Thank you.
Thank you. Sheriff Asbell.
Yes, thanks, Connie. I'll begin with a quote from Brian Stevenson. Always do the right thing, even when the right thing's the hard thing. And I've often say, don't overcomplicate this. You don't have to be on this group or this committee, or you have to write a check. It's just that belief that everyone's significant, and just taking that time when you're walking through the mall or Walmart, and if you see someone that looks like they're in distress, just use that as an opportunity to say, hi, how are you? To build that relationship. There's so many people suffering, and you don't know, if you just say a couple words to someone, you might change the whole trajectory of their day, their life, their future. And it's these small things that we can all do on a daily basis. We live in this world now where so many people don't even know their neighbors' names. And it's just getting out there and being involved. And when you see something, don't be afraid to just ask them, how are you? And it's, again, I just think it's little things like that that can possibly stop someone from going to a life of crime, stop someone from, self-harm later that night. So it's just those little things. Thank you for the opportunity.
Thank you. Ms. Tisdale? Oh, sorry, Chief Tenley.
I'm going to reiterate a lot of what's already been said, but we got to recognize those situations that can lead to violence and work to de-escalate them before they reach their boiling point. In conversing with one of my coworkers today, we discussed, before you do anything, when you're thinking about violence, everybody should have somebody that they have to call first and just run it past somebody else to say, is this a good idea or not? We used to know all of our neighbors and speak to them on a regular basis. In our social media world, we're only seeing the lipstick and mascara, as we often advertise how great everything is on our feed, when there might be large amounts of stress and mental health issues racing through our minds. The stigma and violence and substance use disorder cause many not to seek treatment or to reach out for help. Once the violent act is done, it's up to the police and emergency medical services to repair what we can. And we don't often view the person that ends up in prison as a victim, but that person is also very much stigmatized, and the trauma that befalls their family can also reach into the next generations. I speak to this as a son of an alcoholic farmer, where the expectation early on was that I would fall into that exact same line of work as well as drink. I do not drink, as I viewed what happened to my family at an early age as bad, and I chose not to follow that path. I can tell you that the drive to drink alcohol is in my blood, and it has to be suppressed from time to time. And I like to think that that makes me better at my job and decreases the stigma view when you have personal experience to the loss or actions that these events create. As for substance use disorder, everyone should be trained to recognize the signs and symptoms of overdose, and the process for providing naloxone and chest compressions to those that aren't breathing or are not breathing effectively. We need to make naloxone widely available, keep it in the hands of those around people suffering from substance use disorder, and the treatment options need to be made available for both new and relapsing patients, as they are fighting a battle that it's easy to lose ground and it's tough to regain that ground once lost with the insurance and Medicaid rules. In many cases, in the past, when a person sought treatment for substance use disorder, they may be on a waiting list for a long period of time. I don't know if those waiting lists still exist or not, but during that time, the community and responders got to support them rather than shun them, to give them that opportunity to recover. And I appreciate the invitation. Thank you.
Thank you. Ms. Tisdale.
So I think, I keep going back to the awareness part of this. Love thy neighbor. And I think that's prevalent in the previous messages as well. Social media has taken away a lot of the in-person relationships that, for instance, I grew up with. And I see that with the next generation down. And by the way, any age group, whether it is middle school, high school, are never too young to get the honest truth and facts about mental health and substance use. I think we've tried to make this tiptoe around these subjects and these topics. My son went through the DARE program and was advised, just say no. But what we didn't explain was why. Why do you just want to say no? So I think our younger generations, we really, really need to give them the real-time information and education. And get involved in your community. If there's a group or a group of individuals that are trying to address these very issues that we discussed this evening, it's very easy to sit back in judgment and point fingers and put blame and so on to people. But it takes a little bit more initiative and energy to get involved, to try to make change, positive changes. And so with that, I guess the biggest overall out of this would be to get involved, get out there, get in touch with your community, with the people that live around you even. And I too am very thankful for this opportunity this evening.
Thank you. And next we'll go to Ms. Rossman.
Yeah, so I think there are so many ways the general population can get engaged. It's no coincidence that the highest crime areas, the 61605 and 61603 zip codes, are the second and 22nd poorest in the state. That lack of resources, but there are so many organizations doing wonderful things that could do so much more if people wanted to volunteer, whether it was a one-time opportunity or consistently. And I think mentors are really needed in this community. So I know Big Brothers Big Sisters currently has a waiting list of 78 children, and most of them are boys. And since 43% of the homes are single mom households, 43%, across Peoria, we really need more male role models. But adults also need mentors as well. So at Neighborhood House, we have an employment program, and a lot of times people lose their jobs because sometimes they just didn't think to ask about, well, what if I have a childcare issue, or what if I get a flat tire? They don't even know who to call. So I think it's really important that we all just wrap around those, as people said, whether it's our neighbors or just volunteering to spend some time, and because you don't know what you don't know. So a lot of different ways to get engaged, but I do appreciate the opportunity to be on this panel as well.
Thank you so much. Ms. Andrus?
Yeah, so increasing knowledge and awareness on these issues, like many others have said, further evaluate the inequalities that are leading to disparities in mortality throughout Peoria County. Research has shown that the social determinants of health, such as economic resources that have been mentioned by others, occupation, education, and racial and ethnic group, have proved to be accurate predictors of health status and longevity. Inequities in these social and economic factors can contribute to long-term stress and consequently reduced health and premature mortality. Such disadvantages should be a priority for action to reduce unnecessary mortality and improve the overall well-being of our community. You can also advocate for policies that make our community safer. A law was passed earlier this year allowing more providers the ability to prescribe buprenorphine. Previously, physicians and nurse practitioners had to undergo 8 and 24 hours of training, respectively, to obtain an X waiver from the DEA in order to prescribe this medication. Legislation such as this that increases access to treatment services is imperative to ending the opioid epidemic. Another piece of legislation that was discussed during a Senate subcommittee hearing today is the Eagles Act of 2021. This is named for the mascot of Marjorie Stoneman Douglas High School in Parkland, Florida, which was the site of a February 2018 mass shooting that killed 17 students and teachers. This law proactively mitigates the threat of violence by allowing family members and law enforcement to petition a judge for an order that temporarily removes guns from someone who shows signs associated with targeted violence, much like an order of protection. And this law has bipartisan support. Universal background checks also have bipartisan support, with 84% of Americans agreeing on such measures. The current lack of background checks facilitates trafficking from states with fewer restrictions to those with more restrictive policies in place. And lastly, get involved or volunteer. As others have mentioned, you can volunteer for a nonprofit such as PCAB or JOLT, their harm reduction facility. You can also join a committee, the Community Health Improvement Plan committees. We focus on, mental health and substance use are both priorities for the 2020 through 2022 Community Health Improvement Plan. These committees are tasked with implementing and evaluating evidence-based strategies to improve health outcomes throughout the Tri-County area. And you can visit healthyhoi.com for more information on those.
Thank you. And we'll go to Coroner Bannock.
Yeah, I won't belabor the point. Lots of fantastic suggestions made by the previous panelists, but certainly through volunteerism, we develop empathy. I know that I've learned a lot just in my, the short few months that I've become the coroner. I too have been touched by a loved one who passed away from overdose. So, if you too have been touched, I would encourage you to channel that energy into helping others. If you haven't been touched intimately by this, I would encourage you still to get involved in volunteer efforts as a means to give you a greater perspective and context for this crisis that we're experiencing. Thank you.
Thank you. I'd like to thank all of our panelists for sharing their expertise, their experience. And I would like to introduce Dr. Lisa Snow. She is with the Northwestern Feinberg School of Medicine, and she is the Community Outreach Coordinator and is going to share some information with us now.
Okay. Thank you so much, Connie. Wow, what an amazing group of panelists. You came prepared with some great information and really thoughtful comments on how people can learn more about overdose and how they can do things to help people avoid overdose, and especially the conversations about violent death. For those of you who don't know me, I'm retired from the city of Peoria as the Assistant Chief of Police, and my job now is to be the Community Outreach Coordinator for Northwestern School of Medicine. I am here in Central Illinois and in the southern part of the state. I really kind of cover everything south of I-80. I am available to come out to do presentations for your groups. I helped put together this presentation and can do that in other jurisdictions as well. If you're interested in that, I'm going to share my contact information so you can kind of quickly take a photograph of it, keep it close so you can give me a call. I'm available really year long to come out, and we really want to make sure that people understand this data has been collected in Peoria for a long period of time. We started with IVDRS in 2006 collecting data on violent death, and from there we have done a lot with that research. Like Marianne mentioned earlier, if you go on and read some of the articles that has come out of this research, I heard Roland earlier talk about the increase in babies, for instance, that were co-sleeping, dying in co-sleeping because of suffocation. Early on in our research, that was one of the early things that we learned. We actually started to take a look at the violent death data. We found out that a lot of cases that were being ruled as SIDS actually had been due to co-sleeping. So it's probably a time again in this generation, that's been over a decade ago, to re-educate the public again about co-sleeping. But that's the types of things that come out of this data. And before we move forward with our conclusion, I just want to take a really quick opportunity to answer some of the questions that have popped up. So one of the questions, the first one being from Roberta Parks, and you panelists can hop in anytime as well. Roberta is asking, why don't the other counties participate, only 42? We are in a constant state of trying to get more jurisdictions to share their data. I think that we are really making big strides in that. I went to a conference recently, a conference, and I think 5 more are going to share their data. It's just a matter of education and they have to share their police reports that have confidential information and their coroner reports that have confidential information. And we need to make sure that people understand that that data is going to be protected before it's shared. I think the next question, how do you explain the big increase in suicide deaths in 2020? I really feel that was covered very well by the panelists. So unless somebody has something to add to that, I think that was pretty much covered.
I just want to say something from an overall perspective, which is that there was no measurable increase in suicides during COVID. And the American Foundation for Suicide Prevention actually had sort of predicted that, thinking that COVID could bring around some closeness to people who maybe had been isolated before, but now were more connected to their communities, and also some lesser psychological consequences of people feeling isolated because they weren't going out or being social because no one was going out and being social. Those are still theories, but I think we're pretty clear that suicides in general haven't increased much during COVID.
Doctor, can I ask you a question though on that? Is there data to support the attempts or instances of crisis have increased?
I have limited data, and most of my data come from our emergency department at Northwestern, but we've seen a big increase in attempts. So I think that that's an important distinction.
Thank you.
Hey, Cheryl asked what programs are offered or should be offered to heal the harm to families done by these deaths. I'll ask the panelists to pop in, but we did have some conversation about that. So maybe Becky has something more to say about that, or?
Really, it's just a case-by-case basis of the families I've worked with. They've all had very unique needs, but across the board, the ones I mentioned about therapy, trauma-informed therapy for kids under the age of 10, and services for grandparents raising grandchildren, and then parenting classes for older kids are the big needs I'm seeing.
One of the things we do regarding substance use overdose deaths is we have families reach out to us, generally speaking, 2 to 3 months later after the insult. And we have families who have gone through it in the years prior, who we actually refer the family to for direct support, someone who's actually gone through the death of a loved one from substance use. So we pass those names on, and they make such great connections with other family members for that support. So that's one thing that we do for families who have lost someone through a drug overdose.
Lisa, I'd bring this into conversation too, though. I think we need to address availability of resources. For example, running the jail, I've often said it's a de facto mental health center. I run the largest mental health center in central Illinois. I currently have 0 mental health workers. Just because they're not available. We don't have the availability. We're doing a lot of telepsych and other things like that, but it's, again, having talked with our younger generations to get in these type of professions so we have more resources. I'm excited what Unity Place is building. I think eventually we'll get there, but today, it's scary because we don't have the professional resources we need, especially for juveniles.
And honestly, and this is Sue, that's something that's very personal and dear to me, and as well professional with Unity Place. And I've been in a lot of conversations with our jails, especially because jail is no place for someone that has a mental health or substance use issue. And notoriously, that is what we've done, is if we lock people up for these health issues, when in fact we need to make that connection right then and there while they're there, and offer services, give them the options at least, so when they exit out of that system, they are connected already with, even if it's counseling or a treatment, whatever it may look like, but making that connection then is really essential. And that's something I'm really proud to be working on as well.
Can I just add one more thing to that? And I totally agree with you on that, Sue. But part of my argument right now is we don't have that infrastructure in existence. I don't want to be housing these people in the jail. They don't belong here. But I've often said sometimes we're the only reason that they're alive, that we can keep them safe. We do everything we can because we don't have the infrastructure here locally compared to, the collar counties or Cook County. And eventually we'll get there. I just think we just need to slow down the timeline on some of these things that's being done through legislation.
Anyone else?
I would just like to note the trauma recovery center model developed out of San Francisco that really looks at victims in terms of family relationships is a valuable model to look at. I thought there was one in Peoria. I'm not sure. I thought St. Francis had it, but at any rate, I encourage everyone to think about that. It's really about treating the whole family when one of these deaths occur.
And just to add for support, for individuals that have lost someone to a substance, there is an international group that I belong to. It's called GRASP. It's Grief Recovery After a Substance Passing. And they basically are a huge group of individuals that have been affected, that come together and share, give support, share that support. And we had local meetings for that at one point in Fulton County and Peoria County, and tried to initiate that in Tazewell County. But I think it's gotten kind of shifted to the wayside with COVID, and I'm hopeful to pick those back up.
Anyone else? We'll take another question then. Let's see. Did the closure, this is from Katie, closure of public buildings such as libraries impact the location of overdose calls for service compared to the previous years? I don't know if anyone would have that data. Maybe
I can speak to that a little bit. We didn't really see a big increase or decrease in the ratio of overdoses in homes and apartments versus businesses. And the library, I will tell you, was not a super popular place for overdose. We had a few, more likely as a McDonald's bathroom or a Circle K bathroom.
And I have actually trained and provided Narcan to the Peoria Public Library System. They are all equipped and trained to respond as well and know to look for the signs. And there are other public libraries as well in our neighboring counties that have had that same training and are equipped. And I have not heard back personally of them having to actually respond. But they are equipped.
anyone else? Okay, we have, looks like we have one more question, time for one more question. How do coroners / medical examiners make the determination between suicide versus overdose death when it is a substance abuse related death, of course?
I can take that quickly, and I'll let Jennifer add to that. There's really no easy answer to that. We have to look at the big picture. Why were we called out? How was the person found? We interview family members, we interview and talk with the police department, and we do that investigation in tandem. And then we do autopsy and we do toxicology testing. And just because a toxicology test comes back positive for an opioid or heroin or fentanyl, we have to look at the quantity of it too. And was it enough to actually take their life? Were there other circumstances involved? And based on that huge picture of this investigation is where we generally make that conclusion. We can't always use intent. Was their intent to harm themselves, or was their intent not to harm themselves? It has to be considered, but it's not also the deciding factor every time. So we have to look at the big picture. We have to work with our law enforcement and certainly work with families. And Jennifer certainly add to that.
Yeah, no, I agree with you, Coroner Harwood. It's not an easy answer. Sometimes if a note has been written or left, sometimes that makes it a little bit easier, but it certainly isn't definitive. So.
Okay. Anyone else? All right, with that, I'm going to hand it back over to Connie for the conclusion. But again, I want to thank the panelists for really what's been an amazingly informative presentation from all of you. So well prepared. Really appreciate it. Connie?
Yes, and I just want to echo that. I appreciate the expertise and the knowledge that has been shared here this evening with those who are watching at home. Thanks to all of you. And I also want to thank Lisa for coordinating it, and for the team, for our partner, the team from Northwestern University, Feinberg School of Medicine, Dr. Mason, and everyone who has worked hard to make this happen tonight, despite the technical difficulties. And I think that you've all given us some concrete things that as individuals, we can look in our community and see where can I help, whether it's a volunteer, just being friendly to that person you see on the street who kind of looks lost. And just getting to know people and being aware of your surroundings and make something happen where you can to help people. But certainly the awareness, the education, getting rid of the stigma. Some of these are really big tasks, especially socioeconomic situations, as several panelists have mentioned in the specific zip codes 61603, 61605. We've certainly got a lot there, but we can make a huge impact on our community if we each take some small steps. And I hope that you will have those takeaways with you and take action on them. If we don't take action, we really don't take things to heart. So again, thank you very much. And as Lisa said, this program is being recorded and it will be made available in the next week or so. So thank you very much and good night.